Hi, I'm John Mertens. I'm running for U.S. Senate in Connecticut in 2010 as an independent. I'm producing a 30-minute TV show each month that will run on this channel in which I discuss a different topic in depth, giving you my opinions and a lot of facts and information. Today we're going to talk about health care. We're taping this in the middle of December of 2009, so by the time you see this, Congress may have passed a health care bill, but right now they're debating it in the Senate in preparation of possibly passing it and talking to the House of Representatives about merging the two bills. In case you haven't seen any other episodes, this is our third installment. I'll talk a little bit about myself first, very briefly. I'm a professor of engineering at Trinity College in Hartford. I also teach some public policy and environmental science. And I'm running for U.S. Senate as an independent to offer you calm, intelligent, nonpartisan problem solving, because I believe that neither Republicans or Democrats are addressing long-term problems. That's one reason why I'm talking about health care today. The biggest fiscal issue that we face long-term is Medicare. Medicare has a $36 trillion shortfall in the next 75 years. $36 trillion. Our GDP is $14 trillion. So this is the biggest challenge we face. And it's because we have an aging population. In 1960, we had 5 workers for each retiree. Now we have 3.3 workers for each retiree. And in about 20 years, we'll be down to 2.1 workers per retiree. So that produces a big challenge financially in funding Medicare and Social Security. So I believe we need health care reform in the United States for that reason alone, but for many other reasons, as we'll talk about today. And there's a lot of talk about terms like single payer, socialized medicine, government health care, terms bandied around like that. And I don't think a lot of people really understand what a lot of those terms mean, because they mean different things. I learned a lot by reading a book called The Healing of America by T.R. Reid, and I'm going to be talking about a lot of information from that book today. I think every member of Congress should read this book, and all of you should read it. Then you'd understand a lot of the big issues. It may sound like I'm criticizing our healthcare system in the United States during this show. And some people might feel that that's unpatriotic in some way. I think it's patriotic to look at our country critically in a constructive way and try to make it better. I think that's what patriotism is, to try to make the United States a better place for all of us. So, I'd like to read something from this book. I know reading isn't the best thing on television, but let me just read this statement. Most Americans can remember when our politicians used to boast that the United States had, quote, the finest healthcare system in the world. Today, any U.S. politician who dared to make that claim, it was last heard in a State of the Union address in 2002, would be hooted out of the room. Americans generally recognize now that our nation's healthcare system has become excessively expensive, ineffective, and unjust. So we're going to try something new today. We're going to use some slides from on the screen for me to talk about some information, and I've got hard copies to follow along. So, and by the way, I've got a cold, so if I sound a little hoarse or I start coughing or something today, you know why. But the show must go on. So let's take a look at the first slide. And I entitle this show, Healthcare, Facts and Myths. And I was watching some of the talking head shows on Sunday, and Senator McConnell, a Republican from Kentucky, said on television, the United States has the best health care in the world. Well, we're going to examine that today and see if that's really true and see if there is a need, in fact, for real health care reform. To talk about the best health care system in the world, we need to talk about some criteria. So on this next slide, you can see 4 criteria that Mr. Reed uses in his book called The Healing of America, that he uses, he examines different healthcare systems around the world. And he looks at 4 different measures of quality, of performance, I should say. Coverage, what percentage of the population receives health insurance and health care. Quality, how good of health care they receive. Cost control, which all countries in the world are struggling with right now. Everybody, all of the developed countries are facing this aging population problem, and they're all struggling with cost control. And then choice. Are citizens allowed to choose what kind of coverage they receive or what doctors they can go to? So with those 4 things in mind, let's take a look at some of the things that, some of the systems that exist in other countries. Oh, I'm sorry. We're first going to look at cost in different countries. You can see in the United States that we pay a lot for health care by several different measures. One is percentage of GDP. And you can see that we spend, this was in 2005, I think it's gone up a little bit since then. I think it's about 16% now. But in 2005, we spent 15.3% of our GDP on health care, the most of any country in the world. It's even more expensive than that because we have the highest GDP per capita of any country in the world. So if you look at it in terms of dollars per person, we spend a lot more per person in the United States than any other country. The only number I could find in dollars per capita was France for comparisons purposes. But you can see that the GDP, we spend about 50% more per GDP of any other country. And we spend $7,000 per person in the United States for health care. France, it's about $3,000. Some of the other countries up there would be a little higher than that because Germany has a higher GDP per person than France. But you get the idea. On this graphic, you can also see the percentage of people that receive coverage in all of these countries. In the United States, it's about 84%. You've heard numbers like 47 million Americans do not have health coverage. That's where that number comes from. All of those other countries have made a commitment that everyone has a right to health coverage. We'll talk about that more later. So let's talk about the kind of systems that these other countries have. Mr. Reed talks about 3 different types of healthcare systems. And maybe you have to look, don't worry too much about reading the fine print on there, I'll help you with it. But the Bismarck system, it's in Germany, Japan, France, Switzerland, Belgium, some other countries. I just put a few of them up there. To the right of the type of system that's on the screen, I list information about the providers of health care, meaning the doctors and the hospitals and that kind of thing. And then the payers of health care, usually meaning the insurance companies. So you'll notice that the Bismarck system has both private providers, so the doctors and hospitals and those kinds of things have their own practices, they're privately owned, and the insurance companies are private also. So you wouldn't call this system national health care or socialized medicine. However, it functions in a very similar way to a single-payer system. We'll talk more about the Bismarck system on the next slide, which we'll get to in a minute. The one thing to learn from this slide is the Bismarck system, the big difference between the Bismarck system and what we have in the United States is that the insurance companies are all non-profit. That's a big difference between the Bismarck system in Germany and France and the system we have in the United States.